Hello, it's Dr. Diana Hoppe, and welcome to my Facebook Live. So this is where I answer the questions you want to know the answers to, right? So I am a board-certified OBGYN with 30 years experience, and here's where you can ask your questions. I also have my amazing Over 40 site, and I wrote a book about women in menopause, and you probably know about my dog Rudy, who I'll probably show in a second. Hey Rudy, come here. Rudy, come here, boo. No, he's probably getting all groomed right now. So one of the questions I had was from one of my patients named Vicky, and she wanted to know what my opinion was about testosterone therapy. So this is a great question. So a lot of women, when they go through menopause, get on hormone therapy, which is estrogen or estradiol and progesterone. What we also can do, let me get this down a little bit more like that. Okay, cool. So we also can talk about testosterone though, because that's another hormone that can decrease as the ovaries are not making as much as before. As we know, menopause starts about age 51 in general in the United States. It's when the ovaries no longer have the follicles, so no longer have eggs to ovulate. And when that happens, you lose a lot of hormones, specifically estradiol and progesterone. But you also lose testosterone. So the question is, should every woman be on testosterone replacement? Great question. Probably the answer is not every woman needs it, but some women do need it. And what we do is we use a very low dose testosterone. Why? Because if you give a woman too much testosterone, it can cause aggression, irritability, acne, it can cause hair growth. So giving a woman testosterone, you have to be very careful because men in general have much higher levels of testosterone than a woman will have, right? So we can't give a man's dose of testosterone to a woman. So what we do is we normally use a compounding pharmacy to make the testosterone cream. Now there are some things called androgel and things like that that are prescription for men, and some women use that. I personally don't like those because they're too high dose, and to try to get the correct dose for a woman to be much lower is very difficult. So I prefer using a compounding pharmacy, which are very common around the country. And you have to have a good compounding pharmacy, one that has quality control, one that actually knows that is certified and they are quality control, so they make sure what's in it is actually in it and there's no problem. So there's some very good compounding pharmacies in the area where you live. And if your provider can find that for you, that's great. If not, you can always do a consult with me and I can try to help you find the one that's best for you. But back to testosterone. So what we do is I would call the compounding pharmacy and make a low dose of testosterone cream for my patients. And this would be like a 1 to 2% cream, which if you actually use it when they do it to the pharmacy, it's called 10 milligram per gram or 20 milligram per gram, which is a 1% or 2% testosterone cream. Now with that, it's gonna come like in a little bottle. You take the cap off and you go click, that's 1 click. Or click, click, that's 2 clicks. And you're gonna put it on your inner forearm. Why? Because you don't have a lot of hair follicles there. Most women don't wanna have a lot of hair growth at different parts of their body, right? Especially like their inner thighs or other areas. So I do not recommend applying testosterone to your inner thigh. I recommend applying it to your inner forearm because you're gonna absorb the testosterone transdermally, which means through the skin, but you're not going to get the hair growth that you can get if you apply it at other areas, right? Makes sense. So with testosterone, you have to be very careful, as I said. So you don't want to go too high of a dose for a woman because you can get aggression, acne, hair growth, and sometimes if it's too much, you can also get too much growth of the clitoris, which is not good. So we want to make sure you're under the care of a supervised physician who will monitor your levels, make sure you're not having any side effects, and make sure you're having the benefits. So what are the benefits we want with testosterone? Well, it's been shown to increase muscle mass, also help with joint pain, helps with libido, so increased thoughts about sex and desire for sex, and just overall longevity. So testosterone is something that definitely we can add to your hormone protocol. It definitely has pros and cons, and that's where you should talk to your doctor about specifically what are your goals, and if we give testosterone therapy, what are we looking to benefit? and we also want to make sure you don't have negative side effects from the testosterone cream. So that's a great question. Thank you, Vicki, for bringing that question to us. If any of you have questions, please put them in the chat box, and then I could take a look at what they are so we can answer them. So any questions you have, this is your time to ask. This is Dr. Diana, and it is Facebook Live, and I talk about anything you want to talk about. And again, I've got 30 years of experience, so it's kind of cool that you can have this time with me. So if anyone, again, is watching, wants to ask the question, just put it in the chat box. And I hope that I can see them in the chat box. I'm on my phone, so I'm on my iPhone. So my cell phone sometimes doesn't give me that big of a screen. So if someone makes a comment, I might be able to see it. Hopefully I will. But I have other questions that people have asked me in the past that I can definitely go over, because these are major questions that happen for women and men, as we age, right? So one of the things I get a question about is, why do I have this mid-abdominal weight gain, right? And for women in menopause, it has to do with the hormonal changes that are happening. So what do I mean by that? I mean that with menopause, you have decreasing estradiol and progesterone, which that in itself can cause redistribution of your fat. So that means it goes from your hips and your thighs to more of your abdominal area. And most women don't want to have a muffin top. So that's not really a fun thing to have happen. Now, men may also have a distribution of fat that happens as they age, but it's much less rapid. That is, it's more slowly. So their testosterone levels will decrease about 10% per decade, which is not what a woman's estrogen and progesterone do with menopause. It's like a steep decline, like basically 100% decline in those hormones. Whereas a man's testosterone levels do not do that. So they don't have the same kind of hot flashes, night sweats, mood swings, irritability, all that stuff that women can have with menopause. Men tend not to have those severe symptoms. But over time, they may need some testosterone for just energy, muscle mass, just feeling better, libido, etc. So that goes back to the testosterone question that I first was addressing. So back to the muffin top part. So it happens because we have the distribution of the hormones, of the fat that's redistributed because of the decreasing estrogen and progesterone for women. And then also we have decrease in testosterone. So how do we combat this? Well, a lot of things can go into why we have weight gain. One is we don't burn as many calories. So our basal metabolic rate is much lower than it was before. So we were in our 20s and 30s and 40s, maybe exercising a lot, 2 to 3 hours a day, working out, doing lots of things. We get a little more sedentary as we get older in our 50s, 60s, 70s, and beyond. So exercise is critical to help keep off that extra weight. Another is intermittent fasting. So for a menopausal woman, I think intermittent fasting is a really good way to kind of put your calories in a certain 8-hour period of time during the day, and that will make it so you don't go to sleep after having a heavy meal. So intermittent fasting is like 11 to 7 or 10 to 6, so that if you go to bed like at 9 or 10 at night or later, you're not going to have a big meal right before you go to bed, because all that's going to do is go into fat. So intermittent fasting is also a really good thing that can help with weight loss as well as weight maintenance. Another thing that you can do is you really want some weight loss and you need like maybe 15, 20 or more pounds. I did do a webinar, I should say, on the GLP-1 medications, and that's on YouTube. And it's called Everything You Want, what you want to know about GLP-1s. But if you go to my Dr. Diana Hoppe channel on YouTube, you'll be able to see that video. And it goes over who's a candidate for the GLP-1s, what are they good for and how do they work, and what are the things you should really watch for when you're on a GLP-1 medication. So that's another thing that can help with weight loss. There's also something called phentermine, which is an appetite suppressant, but you have to be cautious of that too. So that's, again, under a doctor's supervision. So there are things we can do about that weight gain, but I think watching what you eat, watching the preservatives and fast food, I really am a proponent of no fast foods, no sodas. We want like a Mediterranean diet. That is the best diet. In general, I find for keeping your muscle mass high, your visceral fat low, and really making so your heart disease risk and diabetes risk is much lower. So you avoid high sugars, high fructose corn syrup, a lot of the bad carbs like cookies, chips, crackers, cakes. Those are just like major sugar, which our body loves and craves, but it's not good for our nutrients. We really need better nutrients that can really give our body what it needs, the vitamins and minerals it needs to be energized and have the brain function and have the muscle mass and all the things we want to do to stay healthy. So there's a lot of reasons why we can have weight gain. I think I had covered some of those. There's some women who don't gain weight with menopause, and you kind of want to say, why is that? Like, why do they stay thin? And some of it's genetics. If you're just got like a high metabolism, you just don't have a body that holds on to that much fat. Some women are just inclined to be more lean over time, and some of us are not that way. We might need to really work on our muscle mass and our calorie intake. So intermittent fasting, something to look about. Check out my GLP-1 video on YouTube. And also you can check out phentermine, which is Phentermine. And that can work as a short-term weight loss for some women. So another question I get is, because water is so important in our lives, how much water should I drink per day? And this is a great question, because I think a lot of us don't drink enough water. The answer is about half of your body weight in ounces of water. So that means if you're 140 pounds, that would be about 70 ounces of water. And that's just baseline. So half your body weight in ounces of water per day. So that's 70 ounces. So if you're exercising outside, you're sweating, you're playing pickleball, you're going golfing, you're at the gym, you basically really need more water. And so that maybe might be another 30 ounces or more. I actually drink this really big thing, and people say, do you really drink that thing? And I do, because when I play pickleball, it's outside and I'm sweating. So I drink about 2 of these a day, sometimes 3, which sounds crazy, but I do exercise quite a lot because I love playing pickleball and I love walking outside and doing the other things outside. So this, I think, is about 60 ounces. So I drink quite a bit, but again, I'm sweating a lot. So, and some of us need more water than others. Another way to see if you're dehydrated or not is to see what your urine looks like. So if you're going to the bathroom and you're urinating and the color in the toilet is like orange, that means you're too concentrated. That means you need more water. When we actually look at our urine, which is kind of funny, like how many people really look at their urine and say, am I hydrated enough? But this is a good way to see, is to see if it's more like a straw color. Like a light straw color means you're well hydrated. A really deep concentrated yellow-orange means you're dehydrated. So now it could be when you wake up in the morning, you do have more concentrated urine. Yes, because you've been sleeping all night. But in general, during the day, when you're using the restroom, you want a urine that's like a more straw colored, and that means you're well hydrated. So I know we had some major tips here today on our Facebook Live. So please let me know your questions. I'm gonna try to do this at least 2 Wednesdays of the month. I'll see how kind of like the interaction is. I know it's hard for sometimes some people to come on at 5 o'clock on a Wednesday, but I am taping this and it will go to my YouTube channel, so you can always review. I also probably take snippets and put it on posts, because I covered some really major categories today. We talked about testosterone, especially for women. It's also good for men. So for those men watching, just know that's also a possibility for you. We talked about the muffin top and how weight gain is really common during perimenopause and menopause. And then lastly, we talked about amount of water you should drink per day. And if you're exercising more, you need even more. So with that, I want to thank everyone that's watching. Please DM me with any questions you have for future Facebook Lives. And I look forward to seeing you. It might be a week from now or 2 weeks from now. But 2 weeks from now, Rudy is going to be in the show. That's August 13th. And so that day, I'm probably not going to do a Facebook Live because he's going to be walking the red carpet. He's going to actually be in the Mandalay Bay resort, because he's going to be in the grooming competition with my groomer. So thank you for all the thumbs up and the stars and hearts. People are watching Rudy on my site. It's so fun to see him. Rudy, do you want to say hi? Are you sleeping? He could be sleeping because he's probably with Kona, my little kitty cat. Next time I'll make sure I put him on with us when we do the Facebook Live. All right, with that, everyone have a wonderful evening, and I'll see you next time. Take care.